Welcome to One-on-One, the Daily Items weekly digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is Evangelical-Community-Hospital CEO and President Kendra Aucker, interviewed by reporter Eric Scicchitano.
Do new car prices scare you? Then you haven't been to Sunbury Motors Kia. Sunbury Motors Kia takes the scariness out of new car shopping with 20 new 2018 Kias under 20 grand.
Welcome to the Daily Items One-on-One. I'm Eric Scicchitano. Today we're hosted by Evangelical Hospital and its President and Chief Executive Officer, Kendra Aucker. Thanks for having us today.
Thanks for the invitation.
So Evangelical, of course, made a lot of news last week with its announcement of a unique partnership with Geisinger. To review, what are the basic terms of that arrangement?
Basic terms of the arrangement are that Evangelical gets to remain an independent hospital. Geisinger Health and Geisinger Health Plan took a minority interest in Evangelical. Basically, they get to appoint 30% of our community members to the board. We get to appoint one community member to the health plan board. And then with that, they're also giving us access to their EPIC, IT EHR, electronic health record platform, and all of the other business and operating systems that feed into that. It's always been the goal of this hospital to have one integrated electronic platform, and they're making that commitment.
In practical terms, how does that enhance the communication that have been going on in-house?
So we have electronic health record, but we have several disparate systems. And so for providers, for nurses, you have to log in and out of systems and onto different systems to get the information. But you could, for instance, be a patient, come into the emergency room, have the nurses get all your information, have all your medications reconciled by the physicians, go upstairs a couple hours later and be admitted to the step-down unit. Same exact questions being asked, same exact information. And the patient says, why in the world do I have to do this again? It's because it's two different systems. It's not friendly to the patient. With being on the same platform, I think for this local region, it's really a sweet thing to have happen because, the data really shows if you don't get your care here, you get it there. We share a variety of patients. It's how the region gets its health care. And so to be able to move freely back and forth and let physicians and providers be able to access your information and see the same kinds of platforms and be able to document in the same kinds of systems, it's incredible for the patient.
The concession in handing over a minority interest on the board, was that an important term in terms of remaining independent?
Sure. Evangelical's a hospital that doesn't need to be rescued. And so much of what you see consolidation-wise across the state is about hospitals that financially are challenged, their volumes aren't great, they're struggling, they're in communities that
There are very few hospitals who have the finances that look like Evangelical's.
That's exactly right. So we didn't need rescued. But I thought our vulnerabilities, and our board felt our vulnerabilities, were around the IT platform. And while we had the resources to do it, you're trying to figure out which one you should do, what makes the most sense for patients. But for a hospital our size, it would take us many, many years to get there. Yeah. This opportunity affords us that. So a minority stake is definitely a strategic move on the part of Geisinger because it is a competitive market and other systems with their own health plans are moving across the state. So Geisinger decided this was the best route to do that. With it gives us the payer strategy, which was also our vulnerability, that we are now tier 1 in the Geisinger health plan. It will help Geisinger market their products. It'll keep the patients of this region happy. So the other part of this is that we remain competitors. So a lot of people are challenged by that a little bit, but there's an economic principle called co-opetition, and you can cooperate and you compete, and as long as both sides find wins, it works, and the win is for the patient. So we will work with Geisinger to bring service lines that we don't offer here, strengthen the things that we do offer, and patients still keep choice. We will still accept Capital Blue Cross and Highmarks and UPMC's insurance products, and patients can come here. This just allows us to sort of take our position strategically that we're committed to the healthcare in this region and the people of this region. And so that's the minority stake. And you have to realize that the state and federal government looks at these kinds of things for antitrust, for anti-competition, and you can't create a monopoly. And so, the reality of it is that even if they wanted to, Geisinger would most likely not have been able to acquire us. And so it really serves both of us well in this kind of climate, but it really serves the patient and the public the best because nothing will really change.
Well, speaking of competition, it was mentioned during the announcement last week that Evangelical was in discussions with other healthcare entities, other providers. Was it Geisinger's financial obligation? I believe it's $265 million joint investment over 5 years. Was that the overriding factor, or was it more about the established relationship, the familiarity with the brand?
Sure. I mean, Evan and Geisinger have enjoyed a great relationship, I would say, particularly over the last 7 years or so. Because I think over the years we put aside our competitive differences and said, Dr. Feinberg often says that his competition is heart disease and diabetes and obesity and those types of things. And, I kind of agree with that. If you put the patient at the center of what you do, you shouldn't be fighting over who delivers a baby where and what should happen. So I think that certainly it was those kinds of relationships and how well we were together doing some things that opened the door for this kind of unique partnership.
Well, can you say if they made the largest offer?
No, I don't think that that's necessarily it. For us, it wasn't about money. It wasn't entirely about money because we have money in the bank.
Yeah.
So what we did was we said, here's what we're investing in Prime, and here's what our long-range capital plan is for the next 5 years. So we're going to take this chunk of money, and they're going to add to that. And those two together equal $265 million. And that includes Prime. That includes the Epic platform. It includes any other work we do on facilities together and work we do on potential service lines. And we're going to spend the next 60 to 90 days honing in what some of those things might be. But for us, there were people who really wanted to take us over. And that isn't necessarily what we wanted. We love our culture. We have the highest engagement scores we've had from employees in as long as I can remember. Same with providers. We've had over a 20% growth in our net revenues. Patients are coming to us. Our patient satisfaction scores are higher than ever. We didn't need to be rescued. We just need a partner. We're a community hospital. We're not all things to all people. So investing, we've been able to reinvest in ourselves. I mean, you've seen all the growth, but we felt like regionally the opportunity to be sponsored on the Epic platform and get everybody in this region on the same electronic health record was good for our patients, and it's good for business, and it's for businesses in the area as well as individuals to have a health plan working together to get the community the best rates. I mean, we need to all work together to drive down the cost of care. There's much national debate about that. So it costs less to get your care here. And so what can we do together that benefits the community that way as well?
You had mentioned the Prime Project, and that's something we'll get more into as this discussion goes on. But one of the things that will be there when it's done is the evangelical symbol, the evangelical name. Right. What does that brand look like today that maybe it didn't kind of reflect before that Geisinger announcement was made?
I think that the evangelical brand is the evangelical brand. If you come here for a variety of reasons. Maybe it's our size. Maybe it's a particular provider that you're fond of. That doesn't change, but I think it's a symbiotic kind of relationship. I think that most of the public doesn't realize the incredible kind of healthcare that you get in this region. And if you leave this area, go someplace else, we find people come back and say, oh my gosh, I had no idea how good the healthcare is. So while you say I'm an evangelical person, I can't do everything for you. We are so blessed to have Geisinger in our region. They're extraordinary. They're well respected nationally. They do a lot of things well. And so you heard David Feinberg say that today also Geisinger got better. So I think Evangelical got better with Geisinger relationship on Epic and IT platforms and other things that we can work together to bring to the community from a patient service perspective. But I think Geisinger gets the opportunity to talk with us about our patient satisfaction scores, how we have engaged our workforce. I really believe that you're never any better to your patients than how you are to each other. And we've worked as a workforce to become really strong and work together to best take care of that. And with that has come higher satisfaction scores and higher volume, people coming to us. They like whatever we have going on here. And so it is a mutually beneficial relationship. And I think that we'll each be able to learn from each other.
We're going to take a quick break, and we'll be back with more one-on-one.
Great.
Choose from 2018 Kia Fortes, Souls, Rios, and Optimas. Kia is the home of America's best value. The 2019 Kia models will be rolling in, and Sunbury Motors Kia needs to move the 2018s now. All include Kia's 10-year, 100,000-mile limited powertrain warranty. New car shopping? Don't be scared. Come to Sunbury Motors Kia.
Welcome back to One-on-One. We're with Kendra Aucker, President and Chief Executive Officer of Evangelical Community Hospital. Today we entered the hospital through the Rook Pavilion. Normally we would come out front. That's all closed off by fencing and occupied by a lot of construction workers and a lot of heavy equipment. The PRIME project is going on. Tell us what that acronym stands for and what it is.
So PRIME stands for Patient Room Improvement, Modernization, and Enhancement. So it is a ground floor and 3 additional floors on top of it, addition to the hospital that really moves us to all private inpatient rooms. This hospital, as most community hospitals, has been built in segments that started in the 1950s all the way through. And so our facility has been kept well over the years, and we've reinvested in ourselves, but the area that was woefully inadequate was the patient care areas and the rooms for patients.
And that was reflected in your patient satisfaction scores.
That's correct. And when they built the hospital in the 50s, it was not uncommon to share rooms with people, and people were smaller, the equipment was smaller, the way that the care was rendered was different. And with technology and advancements and electronic documentation, the space in rooms is crowded when there's 2 people in a room. We also have areas where there's 4 people sharing bathrooms. And, candidly, people don't want to share a room with somebody. When you get admitted to the hospital, you have to be really sick to be admitted.
Yeah.
And you're sick. You don't want to be worrying about a roommate who's got people visiting and they're in and out and you're sharing a bathroom and maybe there's 2 guys sharing the room next to you and the 4 of you have to share a bathroom. So there's also infection control issues, You could have a respiratory infection and be housed with another guy that has a respiratory infection, and the specificity of the testing is such that they find out you both have a different respiratory infection. You're immediately separated. And so you're in a 2-bed room. It goes down to 1. Same for that gentleman. Yeah. And so now we have 2 patients in 2 beds with 2 beds out of service. Right. And so what we found was that we're full as a hospital at about 65% of our occupancy. Yeah. So this allows us to remain the same size, 132 beds, but to have about 99 rooms that become single rooms. The other rooms are our OB unit, our pediatric unit, our acute rehab areas. But when it comes to inpatient, surgical stays, critical care, all of that, it'll be all private rooms.
So what is the projected completion date and where does the project stand as of now?
So the project, we broke ground in August. It's now beginning of October, so it's moving along. It will be finished 2 years from now, so October of 2020. And once the building is occupied, there'll be some renovation work done in the existing building. The last part of it will take another 6 to 8 months. So by June of 2021, the entire project will be done.
So you're going to be hearing the heavy equipment at work for quite a while. Something you're growing used to, right?
The beauty of the project is that the building is built freestanding. And will tie into at the end. So it allows us to disrupt patients who are staying in the hospital the least that you could possibly disrupt them. Okay. There'll be a period where we tie in that'll be a little disruptive, but overall it really couldn't get any better as far as being standalone as you construct it. And yes, there's parking challenges, and we've reversed the flow of patients in the building, and we'll work our way through that. But in the end, it should make the patient experience here all the better.
In designing what it would look like and how it would function, what role did the employees play?
It's a good question. We started with a large team of people internally who are more management type people who really looked at the project, began working with the architects. But then we brought in teams of people in particular areas, asking them to look at it, to talk about what they want. Mm-hmm. But one of the really cool things that we did was we rented space next door over at Plaza 15 that was a vacant space. And the architects had designed and had someone build an ICU bedroom. Oh, wow. And a regular patient room, and then both size bathrooms. And then we brought in furniture that we were considering putting in the new space. And then we allowed every employee who was going to work in those rooms to be able to come in and see them. So whether you were a nurse or a respiratory therapist, a lab tech drawing blood, a housekeeper, you went through those rooms, you looked at it from your vantage point. You know, the nurses looked at the bedside tables and said, this works in my area, this doesn't work in my area. They filled out surveys, and we had hundreds of employees go through and give their feedback because, you know, as a leader, you can sit in a room and say, this is what we need, but you really need to engage the people who do the work in how the patient uses this room. How do they use that room? So we're very proud of how engaged our employees were in this project. So anybody who wanted to say had the opportunity to be heard.
And Prime is the latest in a series of projects. Of course, you've had the West Branch Medical open up and the Orthopedic Surgery Center open up. Right. That's among several in this rapid expansion, as I've described it before. Can you tell us a little bit about the strategic plan that leads us up to this Prime project?
Sure. When I stepped into this role 3 years ago, my leadership team worked with the board and we came up with a strategic plan, and we felt that we first needed to shore up our orthopedic strategy because we're really well known as an orthopedic hospital. Sun Orthopedics is an incredible group of surgeons and really have driven this region for many, many years. So we looked at their space and what we needed to do, so we decided to take the ambulatory surgical center and make that the orthopedic center. So we outfitted new space for them. At the same time, we did a branch of them for them in the Miller Center, which has been very, very well received. We're getting ready this year to start a project over in Plaza 15 in which we have a second space for physical therapy. And then we also have Sun Orthopedic out in the communities as well. But in Lewisburg, this really shores us up. The second year of the strategic plan was to focus on inpatient. And we were, at that time, looking and working with the board, and that's where we came through with the Prime project. And then the third part of the strategic plan, which you'll see in the coming year or so, is more around what we're going to do in women's health. So when Prime is finished, our ability to have a new family place and have new OB areas, as well as better space for the offices, for the doctors and providers to work out of, as well as relocate the Center for Breast Health, which is now in the Orthopedic Center, but relocate that to a much more of a women's center. So I'm giving you a sneak peek of what's to come for us. It will be in women's health. So we're always looking at what do we do well, how can we do it better. We also this year acquired the Central Penn GI Group, and so we have a new endoscopy center, and those physicians have joined our medical services organization. The sort of last family practice group in the area was Dr. Michael Brown's practice at Brook Park Family Medicine. We have acquired that, and so we've had a lot of things going on that just continue to shore us up, but those people have been really part of us for years. They just weren't employed by us. But most physicians now want to be employed by someone. So if you're not employed by Geising or Family Practice Center, you're employed by Evangelical. And that has made us stronger.
I'd be remiss not to ask the cost of Prime and where fundraising stands for that.
Sure. Prime will cost us just about $72 million. It is funded through a bond offering that we've already secured. Some cash from the hospital, but also support from the community. So we have raised, at this point, we've just recently gone public, so we've raised over $3 million of what is a $17 million, or I guess it's an $18 million goal. 15 for Prime, 3 for ongoing annual funds that we do to support other programs. The board, the leadership of the hospital have all given at 100%, and believe it or not, employee giving right now stands at about 35%. So, we continue to drive employee giving and hope to have at least half the workforce who have financially committed to support this campaign. But people love this hospital, and the hospital is what it is because of the community. And so we're going to continue to be independent and sort of control our own destiny, so to speak, and try to remain as strong as we can to continue to serve this community.
Where can people learn more about the fundraising, and if they were so inclined?
Sure, you can go out to the hospital's website, www.evanhospital.com, and there's a tab on giving, and there's information on the Prime Project.
Kendra, thanks for having us today.
Oh, thanks for the opportunity.
Thank you all for watching. Take care.
Thanks for watching One on One. We hope you'll join us next Thursday for another edition.